Again, I reiterate from all chief medical officers that the AstraZeneca vaccine deployed in the middle of a third wave has saved lives and prevented serious illnesses.
If there's one clear message coming from federal health officials, it's this. All the approved Canadian COVID vaccines are safe and effective. But many Canadians want to know why the National Advisory Committee on Immunization says you can wait for an mRNA shot if you don't want AstraZeneca or J&J. Canada's top doctor trying to clear the confusion by saying, if you're not certain, just stick with what your local public health officer says.
There are differences in how you look at benefits and risks depending on the disease activity within your jurisdiction or your local community, as well as your own risk in terms of your age or your risk factors. And the local public health department also takes into account the supply and logistic and other operational elements.
Many Canadians say NACI's advice seems to conflict with frequent calls to get the first shot you can.
The way we get through this pandemic is to get vaccinated with whatever vaccine is offered to us as quickly as possible.
But Dr. Theresa Tam says this is an issue of informed consent. The government can't force you to take vaccines, and NACI is telling Canadians about the risks of blood clots associated with certain vaccines to ensure people know what they're taking on.
We just have to have an honest conversation about it. I think we can enable people to make an informed decision. And of course, in the context of a public health emergency with potentially life-saving vaccines, you've got to enable people to make an informed decision and give them that option.
There's also no update yet on what Public Health or Health Canada has decided on mixed dosing, when someone gets 2 doses of different vaccines. Canadian health officials say they're watching other countries who are mixing doses to see what results will be, but has no decision yet.
If I was to speculate, this is pure speculation. This is not the data. This is pure speculation. It's very, very likely that this is going to be not only a safe thing to do, but also a very effective thing to do. And I think we're going to start to see a lot of that probably in the weeks and months ahead.
Meanwhile, there is some good news about Moderna doses. 1 million doses expected to arrive next week will be arriving this week. Coupled with Pfizer, this means over 3 million mRNA shots are set to arrive in Canada by the weekend. In Ottawa, Xiaoli Li, City News.